All right, good day everyone. So welcome to our learning video for family planning and may I begin sharing my PowerPoint. So as we all know, family planning is one of the DOH programs for our community population, specifically for our couples, the family, the mother and the father. And last time we already discussed the general information about this DOH program. So for today, let's just have a recap of the goals and objectives, the principles, and some of the types that we have already discussed last time. Okay, let's begin. So we know very well that family planning programs, I told you, is an intervention or a tool that is devised to improve the quality of life, the health and welfare of the entire family. Aside from that, it is considered to be an information and it's a service for couples to plan for their family that includes, of course, understanding their context and the acceptability of these methods when it comes to their beliefs. And the goal is for a universal access to family planning. So when we say universal, it is given to everyone. So regardless of the status, regardless of the background, then everyone can have this kind of program. So for example, if you are a single mother, or let's say you're not yet married, or if you're part of a gay family or lesbian family, then you can still be part of this program. So remember, when it comes to the goal of family planning, we talk about the universal access regardless of the status or dynamics of the family. Also, the objective would have or would focus on the achievement of the desired family size and, of course, the availability of family planning services in the community. So the basic principles that we have discussed last time include the following: responsible parenthood, because for parents to become responsible, they must be able to provide for the basic needs of their family members or their children. So of course, if they have the desired family size, then they can attend better to the needs of their children. Apart from that, number two would be respect for life. So I would like to clarify this, that when it comes to family planning, we don't promote abortion, okay? Instead, we promote options for the family actually to have an effective and better family planning so that they can consider, for example, the available services for them to at least provide better for their family. All right. Next would be birth spacing. So it is suggested that for a mother to have a healthy, let's say, pregnancy and for their health, of course, and well-being, it is not advisable for the mother to be pregnant like often, or for example, like short span. So at least 2 to 3 years of, let's say, birth spacing is desired for mothers. So with family planning, this goal would be facilitated. And finally, informed choice. So when I say informed choice, we must be able to give all the necessary education, or let's say assistance and instruction on the utilization of, let's say, the methods, and of course to give everything like the, let's say, the choices for the couple to choose from. So it's not the nurses, it will not be even the doctors who would decide for them. Instead, we give all the information and let them decide on what method will be applicable to them based, for example, on their beliefs and on their current status and the like. Okay, so these are the basic principles of family planning. Now, last time we have already discussed the natural type of family planning. Alongside, for this time, would be discussing artificial, reversible, and permanent. Let's get started with the types. So in the natural family planning, we have mentioned about standard days, the use of the cycle beats, correct? And for lactational amenorrhea, we've discussed about the effect of exclusive breastfeeding on the part wherein the couple can avoid, or let's say, to prevent conception. Apart from that would be the basal body temperature, from the word basal. So the temperature is taken first thing in the morning when the mother does not have any activity yet, and it's taken same time in a day, let's say upon waking up. And in order for us to really determine the temperature of the mother, there are specifications wherein when are the safe days to have unprotected sex, and then when are the unsafe days wherein they have to use, let's say, other methods to prevent, let's say, pregnancy. Apart from that, we have Billings ovulation, or the cervical mucus, when it comes to the elasticity of the cervical mucus. And we have already mentioned last time that If it is elastic, if it is thick, if it is watery, then it is an indication that the mother is fertile. So there should be no unprotected sex. Whereas if the mucus is really inelastic and it is thick, then more likely the mother is infertile. So therefore, sexual activity could be resumed. All right. Also, we talk about symptothermal. So in symptothermal, it's the combination of the two natural methods that will be the basal body temperature and the Billings ovulation. And also we talk about rhythm method. So it has something to do with the calendar method that a mother who knows, for example, his or should I say her regular menstruation for the past 6 months can utilize this family planning. And we know very well that in order for us to use this, then we must be able to record the 6 month, let's say, um, menstruation of the mother or the cycle of the mother. And what we do is to determine the highest number or the longest number, and then the lowest or the shortest number, and then we are going to subtract it. So if it is the shortest, we subtract it to the number 18, whereas if it is the longest cycle, then we subtract it to 11. Whatever would be the result of this subtraction, then that would be the number of days that the mother is fertile. So therefore, there should be no unprotected sex during this period. And finally, in the natural family planning, we discuss about coitus interruptus, and simply the other term for that would be withdrawal. So heavily, this is the responsibility of the husband or the father in order for him not to ejaculate inside the mother. Instead, he should withdraw it and then ejaculate outside so that there will be no conception. Okay, so these are the natural family planning. Let's just go from one to the other for you to be refreshed. So again, we use the cycle beads, and in the cycle beads, there are indication when are the safe time to have sex and when are the times that there should be no sex. So as you can see here, the white beads would indicate that the mother is fertile, so more likely pregnancy can occur. And then the other color, the brown one, that's the time, the safest time to have sex without any conception. Okay, in a lactational amenorrhea, there are questions that we should ask the mother, as mentioned last time. What will be this question? Number one, if she is exclusively breastfeeding the baby. Number two, how old is the baby? Because it is better for this method to work if the mother is exclusively breastfeeding the baby with at least 6-month-old. Beyond that, this method will no longer be applicable. And you have to ask if the menstruation has already returned, because if the menstruation is already there, then this method is no longer effective. All right. And apart from that, if I may add as well, you should ask also the mother if what are the other, let's say, additional food that is or that are given to the baby, because if there are, for example, formula milk aside from the breast milk of the mother, then this is the indication that it is not exclusive breastfeeding. Okay, next one, in the basal body temperature, that's this already discussed clearly, wherein the mother should take the temperature upon waking up. And there is a specific thing that you should know on this, wherein a day or right a day before the ovulation of the mother, the temperature is actually will decrease. So it means to say, generally in this type of family planning, natural family planning, if the temperature of the mother is high, it's an indication that indeed the mother is ovulating. But a day before ovulation, the mother's temperature is really low. It will suddenly decrease. Now, if that's the case, the common question would be, so does it mean that the mother can actually engage in sex? The answer is no, because we discussed last time that even if the mother has low temperature, and of course that's indication that the mother is safe, right after that day, the mothers will already ovulate. And so the sperm, the viability of the sperm would last for 72 hours. So if the mother would engage in sex a day before the ovulation, then it means that the sperm cell on the day of the ovulation is still alive. So it can still be, the sperm can fertilize still the egg. So there could be still pregnancy. So it would be safe that, let's say, days before the ovulation and then days after the ovulation, then it is best for the mother and the father to, of course, practice safe sex. Okay? Let's move on to Billings ovulation, or the cervical mucus method, wherein we focus on the spin barket. It's the fibrosity or the elasticity of the mucus. And we know very well that if the mucus is really thick, then more likely the sperm cannot penetrate um, the cervix. Therefore, there will be no conception, correct? So just to give us a clue on this method, again, let me repeat. If it is elastic, the mucus is elastic, thin, and watery, and of course, it does not break, then more likely the mother is fertile. So remember that again, elastic, thin, does not break, and watery, the mother is fertile. So you cannot have sex. Whereas if the mucus is inelastic and thick, and of course it breaks, it means the mother is infertile. So you can engage in sex. Okay, so that would be Billings ovulation, cervical mucus method. Now, taken into consideration these former two methods, when we take them into one method, we call it symptothermal method. So it will be more effective because it's not only the temperature of the mother that is taken into consideration. Instead, we also check the mucus of the mother. So for example, the mother has like increased temperature, and at the same time the mucus is elastic, so it means to say clearly that the mother is fertile or ovulating, so no sex. Whereas if it is the other way around, then that's the time the couple can engage to sex. Okay, next we have the rhythm method. This is quite let's say difficult for mother to really monitor, especially if the mother does not have a regular, let's say, ovulation cycle. So, because in here the mother has to track the past 6 months of her, let's say, um, ovulation. So, as we mentioned, we have to determine the longest and the shortest. For the longest days, we subtract it to 11, and the shortest days, we subtract it to, let's say, 18. All right, there you go. Coitus interruptus, simply withdrawal. So we're done with the natural family planning methods. This time we proceed with the artificial family planning. So in here, we will be utilizing several things, or let's say materials, for us to prevent, let's say, conception or pregnancy. So number one would be, the most common would be barrier methods, and secondly, injectables, and of course, taking of oral contraceptive pills. And most of you are very familiar with this, especially the mothers in the class. Now, let's begin with barrier methods. So what comes to mind when we talk about barrier methods? Simply condoms, right? So this is considered to be a thin sheath of latex rubber made to fit on a man's erected penis. Let me specify that. It should be worn when the penis is erected. So our nursing responsibility here is to really inform the couples that this should be worn if the penis is only erected, and should not be worn if there's still, let's say, preliminary activities that you're doing. Okay, so it prevents, what does it do? It prevents the passage of sperm into the internal vagina, because there's a barrier. So even if the father or the husband ejaculates, then it could be trapped. It cannot actually go out of the said latex rubber. Okay, so I would like to inform you as well that it's not limited to male condom. We have also the female condom, but in the country, in the Philippines, we're used to the male condom. Okay, now considerations to really work on would be the proper usage. As I mentioned, this should only be worn if the penis of the husband is erected. Okay, because more often than not, especially in the barrios or in the community, the couples are not really well equipped with the knowledge on how to use it, right? So as community health nurses, then we have to inform them that it should be properly used. So again, it should be worn only if the penis is erected, okay? Apart from that, we have to consider those men who are allergic to latex. So if they're allergic to latex, then they cannot use condoms. So let's give them other options of family planning methods to be used. And what's good with barrier method would be it can also prevent sexually transmitted infections. So if there's a question, why is it good to use barriers, specifically condom, then this can prevent STIs or STDs. Okay. Next one, we proceed with injectables. And when we talk about injectables, the most common there would be the DMPA that has the progestin or the progesterone. Where in the progesterone, I would like to specify it really increases or it makes the cervical mucus really thick. That's why it can trap the sperm cell. Okay, so that's the content of this injectable. So again, the common form of which is the DMPA, otherwise known as the depo-medroxyprogesterone acetate, or simply Depo-Provera. In the United States, they call it SHOT. Okay, now what's the content? Again, it's the content of this is progesterone, which thickens the cervical mucus, thereby trapping the sperm cells, just in case the mother will have sexual intercourse with her husband. Now, this is given in a 3-month interval, so it's taken every 3 months. So the greatest consideration is in here is to remind the mother to take it every other 3 months. Now, there's a consideration this can be taken 2 weeks before the schedule or 2 weeks after. So for example, the mother is late. So she's given 2 weeks before it and 2 weeks after the schedule to take it. But beyond that, let's say earlier than 2 weeks before and later than 2 weeks after, then this method will no longer be effective. So again, we have to remind the mother that this should be taken every 3 months with the consideration to work on 2 weeks before and 2 weeks after. So it is injectable. It's given by an intramuscular injection in the deltoid area. So it's being massaged so that it will facilitate the greater absorption of the said, let's say, progesterone or this DMPA. Now, the contraindication should not be given to mothers who have heart problems, hypertension, smoking, and cancer, because aside from the progesterone, it has another, this DMPA has another, let's say, hormones that could aggravate the deposits in the bloodstream, or let's say it somehow facilitate more clotting. Therefore, if the mother is a smoker, then let's say more clotting will really will happen, right? And in fact, this DMPA can aggravate more hypertension or heart disease. Therefore, if the mother is already suffering from heart problem plus this hormone or this medication, then the condition of the mother will be aggravated. So always remember, you have to ask the mother if they are suffering from any of these diseases, because if they do, they cannot have this form of planning or family planning. Okay. Next one, we proceed with oral contraceptives, the most common because it's easier to take and it's heavily available in the community. All right, so it looks like that. And may I tell you that there are 2 types, common types of oral contraceptive. The first one is the COC, or the combined oral contraceptive. So aside from the known progesterone that thickens the mucus or the, let's say, cervical mucus, we have estrogen that prevents the fertilization of the egg, right? So therefore, these 2, when taken into account in one type of pill, then stronger effect in contraception. But then the COC actually, since it has estrogen, actually this is contraindicated to breastfeeding mothers. Why? I'll say it again. The estrogen content of the COC, or the combined oral contraceptive, is contraindicated or should not be given to breastfeeding mothers, simply because the estrogen affects both the quality and the quantity of the breast milk. So if the mother is breastfeeding, specifically exclusive breastfeeding mother, then this should not be given. Okay, now what's the choice of the mother? If COC is not the choice, then we can give them the mini pills, which is specifically containing the progesterone that I told you earlier. Again, progesterone, what does it do? It thickens the cervical mucus, wherein it traps the sperm cell, just in case the husband and the wife decide to engage in unprotected sex. Okay, now considerations. Again, the pills must be taken every day, same time every day. Why? To build a routine, because the effectiveness of the pills should be, of course, the consistency in taking it. Now, if you can see some of the examples of the oral contraceptive, there are actually 28 tablets. And in these 28 tablets, 21 of which the color white, if you can see in the packaging and in the actual pill, these are considered to be active pills. Okay, now the other 7 are considered to be inactive or placebo, just to give, let's say, um, the mother the usual way of taking it. So the 7 of which are the brown and red colors, are only inactive or placebo. What's the indication of this one? Because usually, if the mother forgets, for example, in taking the placebo, one of the 7 of this, and it's fine for her to continue taking the other pills. But if the problem would be the mother, for example, forgot to take one of the active pills, let's say in a day. Now, what should be done? Most of you probably would tell us that, oh, it could be taken, let's say, the 2 pills, or like the 2 pills after a day. No, actually, when the mother forgot to take the active pills, then as much as possible, it should be taken as soon as she remembers. Okay, so for example, one of the pills I forgot today, so tomorrow I'll be taking it immediately. And of course, the other one supposedly on that day should be taken in the afternoon. Okay, so again, so if the mother forgot the pills, one of the pills today, or let's say yesterday, so today in the morning I remembered, I'm the mother, I remember, oh no, I forgot one of the pills. So I should take the one from yesterday and the other one, let's say, later today. All right. So that's okay if the mother forgot, for example, one of the pills. But if it is already more than 2 days that the mother forgot the pills, especially 3 days or more, then you have to discard the pills and start over again, because the effect will no longer be effective. So let me generalize or summarize that. If the mother forgot to take the pills, then she should take it as soon as she remembers it. Let's say on the next day in the morning, and the other pill on that day should be taken, let's say, a few hours after the pill from yesterday. But then if it is twice, thrice, or more than 3 days already that she forgot to take it, then you have to start over again. But the safest part is if the mother forgot, for example, one of the 7 inactive, the placebo, the brown or red, it's fine to continue taking the pills. So again, the mother should take it same time every day. Now, the side effects would include nausea, weight gain, headache, breast tenderness, mild hypertension, and depression. So you have to educate the mother that these are the usual side effects that they can experience after or while taking the pills. And unfortunately, those people who are suffering again from cardiovascular diseases, who has hypertension, who are smoking, and who have diabetes are not allowed, or more likely cannot be given, this kind of family planning method. Especially for COC, again, breastfeeding mothers, they could not be given the combined oral contraceptive, but they have the choice to take what? The mini pills, because it has only the progesterone. Okay, it does not have the estrogen that affects both the quality and quantity of the breast milk. Okay, so this time we proceed with the third type of family planning, which is reversible. So it means to say it can be undone. So as soon as the mother or the father decides to conceive again, then they can go back to the normal state wherein they are capable of conceiving. Now, this includes intrauterine contraceptive, or the IUD, the one that's being inserted with the string, of course, and the contraceptive implants. Okay, let's begin with the IUD. So it looks like this. Intrauterine devices, wherein this is considered to be a small, flexible plastic device that are inserted into the women's uterus. The question is, can nurses insert it? Or can mothers themselves do it to themselves? The answer is no. So it should be done by a professional, specifically, let's say the OB, or it could be the gynecologist or a doctor. So it should be an MD who should insert this. Okay, however, take note, ladies and gentlemen, that this should not be inserted if the mother is probable to be pregnant. Or in the case of those mothers who just gave birth, this is usually installed 72 hours after pregnancy, or this is installed after the menstruation of the mother. Why? Because if this is inserted and then suddenly we forgot to check that the mother is pregnant, then this will result to ectopic pregnancy, which is somehow a worst case scenario. So again, make it sure that once you are assisting a mother who is going to undergo or to be inserted with IUD, then you have to make it sure that the mother is not pregnant. So the best time that this is inserted would be after menstruation or 72 hours after giving birth. Okay. Now, if there are questions like, what if the string was dislodged or it was somehow removed, then you have to immediately consult your healthcare provider, specifically your doctor, so that it could be reinserted or something must be done to secure it. Okay. Consideration again must be installed right after birth, 72 hours as mentioned, and it's not given for probable pregnant mothers. So a woman with IUD, in order for it to maintain its, let's say, to secure its placement, the mother with this one is advised to check the flow of her menstruation every month, and of course the IUD string, because probably it has already dislodged, and so on, and to have pelvic examination annually. All right. So just to check if it is in place or there are something to be done. Now, contraceptive implants. A while ago, they're oral and injectables. This time, implants. So they look like this. So they are like thin rods that are inserted under the skin in the woman's upper arm and provide continuous, highly effective pregnancy. So just remember, in contraceptive implants, this is good for 3 to 5 years, or depending, of course, on the type of the implant. It could be longer than that. So considerations for this part, the subdermal implants that are rod-like are embedded under the skin. So these are being implanted during the menses of the mother, and of course, 7th day after menstruation, because again, we have to make it sure that the mother is not pregnant. Okay. And of course, it contains progestin, and we know that this is like also the progesterone. That what does it do? It thickens the cervical mucus of the mother. And we're done with the reversible family planning. Welcome to the last part, or the type of family planning, the permanent. So of course, mostly this is being done based on culture or observation, are being done by already older couples, or those already reached, for example, the maximum of number of children, and then they finally decided, this is it. We have already 5 children, we have already 6 children, and then we're good with them. So it's time for us to resort to permanent family planning. But again, this depends on the status and decision and choice of the couple or the family. Okay, so again, once this is done, you can no longer go back to the time of like you would like to have more children. No more. Okay, number one, which is common, of course, done for men, is vasectomy. So vasectomy is like cutting of the vas deferens, where the sperm cell really is being released, or it moves from the scrotum to the penis area for ejaculation. The bilateral tubal ligation, on the other hand, would be done among women, wherein the fallopian tube will either be cut or cauterized, so that the eggs from the ovaries can no longer travel to the fallopian tubes, going, of course, to the uterus for fertilization. Okay, so these are the 2 permanent family planning method for couples. So let's begin with vasectomy. So in vasectomy, the vas deferens, as I told you, the one where the sperm cell travels to, going to the penile area for ejaculation, is cut. Therefore, the sperm cell can no longer travel. All right. So the example of this is this. That's the vas deferens, as you can see on your screen. Wherein that's the vasectomy side that it's usually cut or tied, so that the sperm can no longer travel. Thereby, the father can still feel the ejaculation, but there will be no more, let's say, a sperm cell to be ejaculated outside the penile area. Now, consideration: if the father would ask you, There you go. It's now permanent. I'm now, my vas deferens are already cut, already tied. So can I immediately engage into sex with my wife, not having the problem that she might get pregnant? Again, the father is asking you right after, let's say, right after the vasectomy or the procedure, can he immediately engage into unprotected sex? Your answer, please. It should be no. Then when is the best time to do that? So to make it sure that the father does not have already the, let's say, the sperm beyond the vas deferens, because of course the father has produced more sperm and there are already sperm beyond the vas deferens. So once he immediately engage into sex, then the mother can still um, conceive. So in order to be sure that the father has no more sperm cell, then the father should, um, let's say, ejaculate how many times? Yes, you would hear this right, 20 times. So right after vasectomy, to be sure that the father will not impregnate the mother, then he has to ejaculate 20 times. Yes po, 20 times. Okay? Just to make it sure that all the sperm beyond the vas deferens will already be evacuated. Okay, so men should ejaculate 20 times after the procedure before engaging in sex. Now, the final part here for permanent family planning would be the bilateral tubal ligation, from the word bilateral, because there are two ovaries and of course there are also two fallopian tubes. Then these are being tied or cut or cauterized, okay, so that the eggs from the ovaries can no longer travel and go to the uterus for fertilization, right? So it involves the cutting of or blocking of the fallopian tubes, such as what you can see on the screen. All right. But then some of you might be asking me, so, sir, the fallopian tube could be banded. So it means it could be unbanded and can also, again, the ovaries can produce eggs and can travel again to the fallopian tube to the site of fertilization. Yes, but of course, it's no longer that viable as compared to when it was not banded or tied. Okay, so again, it's still considered to be a permanent family planning type. So because of that, what would be the consideration? Since the fallopian tubes are already tied, if the mother would ask you, common questions would be like this. Will I still menstruate? Will I still have my menstruation? So your answer, please. Do you think the mother whose fallopian tubes were tied, cut, and cauterized, will they still have menstruation? Okay, have a moment to think. Yes or no? If your answer is yes, then normally you're good. Yes, the mother will still menstruate, because at the end of the day, menstruation does not happen in the fallopian tubes anyway, right? It's in the uterus area. So there you go. It's the uterine lining that falls off and not the fallopian tube. So expect that the mother will still experience menstruation even after fallopian tubes ligation. Okay, so consideration, there's still menstruation even after the procedure. So there you go, everyone. Those are the types of family planning. And this time, taken all these types, these are the most important considerations for us nurses to really advocate for our not parents, for our patients. Number one would be personal values. We have to really respect whatever their beliefs are. For example, the mother would say, oh no, we will not use let's say this kind of family planning because this is against our belief. Then you have to respect that. So what should you do? You have to give them other options to choose from. Aside from that is the ability to use method correctly. If the mother, for example, would tell you, "Oy, madikman na amuti agbilang. Di naman ako marunong magbilang, tsaka makakalimutin ako." So if these are the answers of the mother, then more likely you would not suggest or you would not let them use, for example, the rhythm method, right? Or if they cannot use, for example, the temperature, the thermometer, more likely you might consider other family planning types or methods for them to use. So again, it depends on their ability to use the method correctly, because at the end of the day, even if you let them use it, but they did not use it properly, in the case of the condom, correct? Or in the case of the calendar method, wherein Instead of counting and monitoring, for example, the fertile days, they use the calendar as, let's say, math before they engage in sex. So that alone will defeat the purpose of the family planning. So again, um, assess or ask if they can use it. Otherwise, you can educate them or you can provide different options for them to use. The third one would be how method will affect enjoyment. So if the father would tell you, oh, pwede ba sa akin yung vasectomy kasi baka hindi na mabababa yung pagtingin ko sa sarili ko, yung nakakalalaki, and so on and so forth. So you have to educate them also. Then you can say, oh, if you don't want the vasectomy, sir, then probably you can use condom, but make it sure you have to use it properly. So this is the way you can possibly negotiate, or let's say communicate with the couples for them to really choose the best method for them. Next would be financial factor. Of course, condoms are not really that, let's say, cheap. Yeah, especially if the branded ones. Good thing in the community, they really give. There are free condoms given to couples. But when it comes to injectables, when it comes to implants, contraceptives as well are given. But what about if, let's say, there are those surgery like the fallopian tube ligation or the bilateral tube ligation, the vasectomy, they cannot afford, then more likely you have to give them, let's say, the affordable ones or those methods that they don't need to spend at all, right? So again, financial factor. Next would be status of couples relationship. Why? Because it affects. When it comes to relationship, then it should not only be the mother deciding on her own. She would not say, oh, nurse, I'll do it because this is what I want. But you have to consult. Is this what your husband wants as well? Because it should be collaborative, relationship, partnership, commitment with each other. Because even if the mother wants it, if the father will not participate, and vice versa, then this family planning method will not serve its purpose. So again, you have to make it sure that the couple agrees to it and they support each other. Next, prior experience, because more often than not, we learn from experience, correct? So there are couples that already use this method, and then this time, before letting them again use it, you have to ask, you have to assess what went wrong in the past when you've used it. Probably there were mistakes on the way they've used it. So you can correct this time. Or it did not work for them in the past. So they might want to try a new one that would work this time. So again, prior experience should be taken into account. Next one would be future plans. Because if let's say the mother is only 30 years old and they have only a child, so more likely you cannot tell them to undergo or to subject themselves into the, let's say, permanent family planning method. O magbasectomy na po kayo. O misis, magpatali na po kayo ng yung tubo and so on. In the case of the fallopian tubes, of course not. If they still want to conceive or to have more children in the future, then you should not give them the option of having the permanent family planning. Instead, you may use, for example, the natural method, the reversible ones. So you have also to consider their future plans because this is big, it might affect their future, their family, right? So you have to know all these things. You have to respect their beliefs and you have to assess and educate the couples accordingly. So those are the family planning methods that I would like you to know and that are relevant because as community health nurses, those are the options, the choices, the methods that will be telling our patients, our couples, for the family in the community. So thank you so much for watching this video. Please watch again for the succeeding or future video lectures for community health nursing. Thank you.